I absolutely love this next question I got. I got a couple really good meat and potato questions, and I'm going to try to do this in 5 minutes. I keep saying that and I go to 8 or 9. I'm sorry about that. I hope I'm keeping your interest till the end. This question was about the similarities of codependency and addiction. Very similar. So they are like a yin and yang, right? They're connected. I help a lot of codependents, and the codependent's addiction is the person. It's the same with like love addiction, okay? Codependency is that kind of addiction. You're addicted to a person. Part of the thing about addiction, I'm going to talk about, addiction in itself is a very selfish, self-centered thing, okay? So when I am in my illness of addiction, alcoholism, first thing, alcoholism is a mental illness, okay? This isn't about the drinking. You can treat this mental illness with a lot of different things. Alcohol, drugs, gambling, sex. I talk about this all the time. The alcoholism I was born with. Something didn't happen to me and I became an alcoholic. I have alcoholism. Alcoholism runs in my family. I'm adopted. I was adopted into a family that were not alcoholics. It was apparent from the get-go that I was different, right? Apparent, black sheep, whatever you want to call it. I was different. I have mental illness. I also see very clearly that my mental illness, once I took away the drugs and the alcohol totally helped me cope with life and deal with life on life's terms, because I think I have some other dual diagnosis, very slight, but I have some mental inconsistencies. I have some OCD. I have some paranoia. Stuff I didn't really realize till I've been sober for like 10 years, right? This stuff is kind of coming up. It goes very closely with the alcoholism, right? I'm trying to make myself more comfortable by using alcohol and drugs or whatever I use. AKA, I quit drinking and using, so I start eating. I start smoking. Very common. People put on weight after they switch addictions. I'll give you one. I quit smoking after I quit drinking because I hated the way I smelled like smoke. Quit smoking, so I started chewing tobacco. Little pouches that you didn't have to spit. You stick them up in your gum. I'd spit. I could do it at work, in meetings, right? People are getting up, leaving meetings, going to smoke cigarettes. I'm fine because I got a thing in my mouth. Nobody knows. It was a big secret. I did it for years. Only people closest in my life knew. So I did it for years, and then I blew out my esophagus. I really screwed up it was all bad. So I had to quit. And I quit, and May 5th, it'll be 2 years. I've been nicotine free. And when I quit, I tried to quit with nicotine gum. I'm kind of getting off the topic. See, this is what happens to me. Tried to quit with nicotine gum, ended up chewing 8 pieces of gum, plus still chewing tobacco. Went to the mints. Now I'm chewing gum, doing the mints, doing the tobacco. I'm a total addict. I can't do anything right. I went to buy it. The pharmacist said, you continue to chew that many pieces of gum. You're supposed to chew it as directed. There's directions on the back. I was like, who thought about that? I didn't. So anyway, he said, you're going to continue that. You're going to have a stroke. So I decided I have to quit, just like drinking. I just have to stop. So I did. And I substituted it with this gum. But this is the only kind of gum I can chew. See, I'm an addict. This is it. I will drive. I have 5 of these at my house so I don't run out. If I run out, I have to go to the store like I did my tobacco. I keep it with me all the time. I don't chew any other gum. And if I go to a store and they don't have this, I will go to a store after store after store until I find it. Okay? See, normal people don't do that. But that's the way I quit chewing. I chew bubble gum now. So I know these inconsistencies have been in me long before I drank. It has nothing to do with the drinking, right? I'm not the same. So the question was, is that the same with codependency? Are you born with codependency, or do you get those, is that a learned behavior? I believe codependency, first things, there's different levels like alcoholism. So one is when an alcoholic gets sober, they very often get very sick with codependency. When codependents get in Al-Anon, sometimes they start drinking. They switch addictions. Okay? Not everybody. Some people just are an alcoholic and don't get the same physical response to alcohol. They get the same physical response, but the addiction doesn't set in. The compulsiveness of having to have a drink again, right? That doesn't set in. But they do switch it around. I believe codependency is more of a learned behavior, and it comes a lot from being around alcoholics. So if you were born into a family of alcoholics, right? If your mother or father is an alcoholic, most likely if you don't become an alcoholic, you're going to become a codependent, right? You've tried to fix your parents, parent your parents. Adult Children of Alcoholics is a wonderful program for children raised in that condition. So if you ask me if it's hereditary, because the two go hand in hand, if your uncle was an alcoholic, your aunt was probably a codependent, right? So it does travel down the road. But as far as genetically being born with it, I think codependency is a little bit more of a learned behavior. It's a way of coping. Now, some people say, well, this is a selfish, self-centered illness. Both of them are. Because when you're in codependency, I often tell parents, like I've helped parents that have 4 children, and one of them is off the chart addict alcoholic. And everything is around that child, right? It's all about that child. And the other 3 are over there getting straight A's, going to soccer, making their own lunch because Johnny gets all the attention. And they're getting kind of left out. See, it takes your attention, just like alcoholism and addiction. Alcoholism and addiction is a self-centered illness. All you're thinking about is that. So part of the answer is to not do that. And in Alcoholics and Addicts, we think about other alcoholics and addicts and we help them. In codependency, we have to quit thinking about the alcoholic and addict and help ourselves or the rest of our family. A lot of similarities in that, right? A lot of similarities in that. So I love the question. I talk a lot. I just did a webinar. It's not out yet. I talk a lot about my childhood and how you can see the alcoholism like way before I drank. And when I drank, why it was such a break for me to start drinking. And it's an interesting layout, whether you're the codependent. If you have a child that's an addict, you might find it interesting. You might find my story very similar to what's been going on in their life. Or if you're the addict, you can see that this is not about the drinking. It's very clear it's not about the drinking. So this illness has to be treated. It will be treated one way or another. And codependency is the same thing. If you are not going to focus on that person, you'll focus on another one. You'll focus on something. You'll just keep switching addictions. So you want to take care of the problem. A lot of the things I do, God damn it, it's 9 minutes now. 5 minutes. I don't know who I'm fooling. A lot of times when you send me a message, I feel like I'm just treating the problem and not the symptom. And I'd rather help you with the symptom. You know what I mean? Maybe that's opposite. I don't want to put a Band-Aid on something. I want to help you get to the crux of it. I want you to solve the problem and not just put a Band-Aid on the symptom. Yeah, I said that backwards. You get it, right? So that's why, on some level, I'm happy that I can just answer a quick question. That's, you're in this spot and this is what you're going to do. But I'd rather help you with the big picture of how you can change your life and not do this anymore. All right. So check out my website. Follow me on YouTube. That would be great if you could subscribe, and I'll talk to you later. Bye.